everyone, my name is Marcela Lianto and I'm from Andrology Class A. Now, I will present my journal review about andrology of male to female transsexuals, influence of cross-sex hormone therapy on testicular function. Okay, so right now let's start with the introduction. Gender is a grammatical classification of words and other related words which are generally related to the existence of two sexes or neutrality. Patients suffering from gender dysphoria or GD experience the sad scenario of a mismatch between the sex assigned at birth and the desired gender. But first, what is gender dysphoria? Gender dysphoria is a term that describes a sense of unease that a person may have because of a mismatch between their biological sex and their gender identity. This sense of unease or dissatisfaction may be so intense it can lead to depression and anxiety and have a harmful impact on their daily life. Okay, next we talk about the methods. In this journal, there are two research methods. The first is treatment strategy and the second is targets of transsexual hormone treatment in patients with a gender dysphoria. Depending on the type of the surgery to be performed, the type of hormone given will also be different. However, its function remains the same, to assist physical change from within. Androgen hormones are given to transgender men from female to male to help them develop male secondary sex characteristics, such as birds and body hair, as well as a deeper voice. As you can see, these are the result of this journal research. Let me explain the result section. Okay, let's talk about the result in general. Transsexual often refers to transgender people who have attempted sex change, such as with a surgery or hormone therapy. In strategy of starting gender reassignment surgery, there are two types. The first is sex change surgery. The first step before performing sex change surgery is usually a consultation session with a mental health counselor to be performed a diagnosis of psychotherapy. Diagnosis of gender identified disorder or gender dysphoria and an official letter of recommendation from the therapist in question allow the individual to begin hormone therapy under the supervision of a doctor. Androgen hormones are given the transgender men to help them develop male secondary sex characteristics, such as beard and body hair, as well as heavier sounds. And the second is hormone therapy. Historically and medically, the term transsexual we used to indicate a difference between one's gender identity and sex assigned at birth, male, female, or intersex. More specifically, the term is often used to communicate that one experience of gender involves medical change, such as hormone or surgery. It can help alter their anatomy and appearance to more closely align with their gender identity. In here, we will talk about function of hormone therapy. The function of giving this hormone therapy is to help the patient physical change into the desired sex. Estrogen and anti-androgens are given to transgender women from male to female to help them change the sound of muscle mass, skin, body fat distribution, and delayed hips. A number of these things will make their physical appearance more look feminine. The typical man's body hair will also disappear too. And the second, it's about risk of sex reassignment surgery. Transsexual who undergo hormone therapy procedure, silicone injection, or surgery are at risk of experiencing several health problems. The following are health problems that need to be watched out form after making a gender transition. For example, infertility, bone loss, high blood pressure, change in body metabolism, and the others. Undergoing gender reassignment surgery or other body form is a big decision and requires careful consideration. In addition, there are various risks to health and social life after undergoing surgery. And don't forget about the physical effect. The first is sex change surgery carries a risk of infection. The second is weight loss, and the last is effect of GHT on testicular morphology. Like other medical procedure, sex reassignment surgery carries the risk of infection, bleeding, and possibly other medical examination to repair the damage. Sex reassignment surgery is permanent and cannot be changed again. The most common complement of male to female genital reassignment surgery is the narrowing of the new vagina. However, this can be treated by dilation or using some of the current tissue to make the vagina. Meanwhile, the complication of the female to male produce is penile dysfunction. Artificial penis grafts are a difficult procedure and will not produce a uniform appearance. Talk about the effect of GHT on testicular morphology. Anticipated effect of GHT on the testes can be derived from male contraception studies demonstrating that gonadotropin suppression leads to spermatogenic suppression. Importantly, this effect can be so affected on spermatogenesis so fully. The last and important topic is about the psychological effect. Transgender people are more vulnerable to symptoms of depression and anxiety, which is at least in part attributable to the social stress they experience as members of a gender minority population. Transgender people may also face challenges related to need to affirm gender identify and the social and physical change this may require. Their psychologists can play an invaluable role. These include assisting transgender people in exploring and affirming their gender identify, whatever this be on an individual, interpersonal, or social level. The psychologists can also assist transgender individuals in recovering from the negative impact of social stigma on their health and well-being, and to facilitate positive experience of coming out within family, friends, or their community. Every journal have their access and efficiency. For the access, this research is considered very interesting because it is rarely discussed in public. And the second is, this research is based on previous research, which is very supportive of the theory on this research. And for the efficiency, this journal is an international journal. For some people, it may be so difficult to understand because it uses English. The conclusion of this journal is how we are able to know things about a transsexual, ranging from understanding the surgical process, hormone therapy to the side effects that can be caused. Thank you very much for your great attention, ladies and gentlemen. Thank you for your listening. May all those I have shared be beneficial for all of us. Thank you so much. Thank you very much for your great attention, ladies and gentlemen. Thank you for your listening. May all those I have shared be beneficial for all of us. Thank you so much.